Hello, everyone, and welcome to the third episode of the Liminality podcast series. For those joining us for the first time, the Liminality Research Consortium is a multi-country research initiative hosted by the Gender Center at the Geneva Graduate Institute, exploring how gender, sexuality, and forced displacement intersect to shape people's living conditions, survival strategies, and ultimately their health and well-being in context of displacement. In this podcast series, we aim to bring together research evidence, field-based insights, and lived experience, creating a space for reflection that bridges research, policy, and practice. In our previous episodes, we began unpacking some of the core themes emerging from our research. In episode 1, for example, we introduced the overall project and its conceptual foundations, focusing on how forced displacement creates conditions of structural precarity and shapes everyday survival strategies. In episode 2, we moved closer to the empirical findings, reflecting on how these strategies are lived and negotiated on the ground, and how they intersect with issues of health, access to services, and broader systems of governance, with a particular focus, of course, on the cases of Greece and Lebanon. Building on these discussions, today's episode brings together insights from two key country contexts, Turkey and Jordan. In this episode, we will move across different dimensions of the research, starting from the broader context, then looking at the patterns and drivers of survival strategies, including transactional sex, their health implications, how experiences differ across groups, and what this all means for policy and practice. I'm very happy today to be joined by two colleagues who have been leading the research in their respective countries. From Turkey, we have Meriç Kaglar, a postdoctoral researcher at the Sabancı University Gender and Women's Studies Center of Excellence, and from Jordan, Hala Abu Taleb, an independent qualitative research and evaluation consultant based in Amman, who led the Jordan research team at the Information and Research Center of the King Hussein Foundation. Thank you both very much for being with us today. It's really a pleasure to have you here. Maybe we can start by setting the scene in each of your contexts, in Turkey and Jordan. Could you briefly describe how forced displacement shapes everyday survival strategies and access to health and support based on your findings, and what structural conditions stand out most? Maybe I can give the floor first to Meriç.
Thank you so much for this invitation, Thanasis. So happy to be joining the Liminality podcast. Well, there are a couple of um, context-dependent issues here. So maybe when we are looking at the structural conditions, I can start with the legal aspect. Turkey actually has a very restrictive migration and asylum policy. And due to the geographic limitation of the Geneva Convention that Turkey has, Turkey only grants for refugee status to people coming from Europe. I know it's quite strange. So all asylum seekers in Turkey are non-conventional or conditional refugees who cannot get the rights and access to services that comes with a full refugee status. And in this conditional refugee system, we have two groups. There are international people under international protection, which are non-Syrian asylum seekers, and then Syrians under temporary protection. So while for Syrians it's relatively easier to register legally, for non-Syrians it's quite difficult. It's almost actually impossible to apply and get an asylum status right now. So another how it relates to our research is that our research was actually conducted in Istanbul, and Istanbul is close to registration for non-Syrian asylum seekers. What does it mean? All non-Syrian potential asylum seekers in Istanbul are either registered somewhere else in another city, which was actually mostly the case for queer refugees, as they are relatively easier for them to get an asylum status in Turkey, but not registered in Istanbul, or under humanitarian residence, which was actually the case for some Afghan migrants and asylum seekers that contributed to this research. But generally, the majority of people were irregular. It's important to mention that this irregularity itself is produced by the asylum system, asylum regime itself, and not that people would not be eligible for asylum in an ideal setting. So that legal frame was quite important for us, and that was one of the most major issues actually we observed in Istanbul. the implications of being unregistered. So, being unregistered means, of course, no access to legal rights, but also no direct access to services, and also the danger of deportation, which forces migrants to remain invisible, force them into more precarious situations. This also leads to, of course, no formal employment, which was very much observed in our research, where migrants had to work in informal, precarious working conditions, underpayment at the mercy of their employers. So, another major finding was that the lack of registration meant very little access to health service. Most informants mentioned that the only interaction they had with the health services was actually in the case of pregnancy, where they had to go to private hospitals and it was quite expensive without insurance. So, what I can say is that we see linear relation between lack of legal status and access to services, which has sexual and reproductive health implications.
Thank you, Merit. What about Jordan, Hala?
Thank you, Thanassis. I'm very happy to be here with you and Marriage. Um, for Jordan has hosted waves of refugees for many years. So for Syrians, most refugees live outside the camps, so in urban areas. That means that they navigate daily life in cities where rent is high, work is limited, and aid is often insufficient. But actually, the vulnerability doesn't begin in Jordan. For many of the people we interviewed, exposure to risk starts during the displacement journey itself. So, particularly at the border, crossing, or where they rely on smugglers. There were stories of exploitation or coercive situations during transit, especially for women traveling alone. Also in camps, because many, when they enter, they go into the camps. Some stay there, but most leave the camps. In camps or temporary settlements, security concerns also shape survival strategies. So, some women explained that being associated with a male partner could reduce harassment or increase protection. The decisions were often described as trade offs, like made in difficult circumstances. Once in Jordan, in the urban context, legal and economic precarity, like also Marriage mentioned, become central. So even when refugees have documentation, access to stable formal employment is restricted. This pushes many into informal and low paid work. Over time, this of course creates financial pressure, paid rent, education costs, health expenses, and this results in significant psychological stress. Another important factor is stigma. Topics related to sexual and reproductive health are, very sensitive in a conservative social context. And for refugees, that sensitivity is amplified by displacement, trauma, and fear of judgment. So, everyday survival strategies are shaped across the entire displacement continuum, from the journey to the camps to urban life, and deeply influenced by legal uncertainty, economic hardships, and social norms.
Thank you, Hala. You have really described the context that the research has taken place, and that was very helpful to set the scene for our discussion today. You mentioned various issues that I think they are common in the two countries. For example, the access to documents and how they shape access to employment, formal employment, and access to services. But also differences like the legal framework that is different between Turkey and Jordan. So I think now let's move a bit more into the specific patterns you observed. Based on your findings, what forms do these survival strategies, including of course transactional sex, take in your context, and what seems to drive them?
Yeah, that's actually a very important question, the drivers. I would say definitely it's easy to see that different patterns of survival strategies, including transactional sex, emerges due to legal and economic precarity. I would say it's mostly shaped by what practices are more tolerated in particular communities. So I think there is this intersectional dynamic to that. As Hala was saying, actually, the first pattern actually starts with border crossing, where particularly women engage in both voluntary transactional sex for security, or even actually in our research, we had observed one case of human trafficking. So, I mean, that was not very prominent in the migration route from Afghanistan, Iran, and Turkey route, as women actually are not allowed to travel alone already. So that was rare, but still prominent in different migration routes. And maybe a second pattern that was observed was in terms of survival strategy and transactional sex was underage and arranged marriages. That was actually the most common one that I can say, I think. So families marry off their daughters, mostly in majority their daughters for economic reasons, also for protection, and sometimes to continue their journey in Europe. That was actually a common practice for some communities like the Afghans, but it was also coming back in the country of origin. The informants said that the conditions of displacement really influenced, even brought back some of these harmful coping mechanisms as a survival strategy in displacement, both due to economic and security reasons. Maybe another dimension is that as migrants work irregularly, mostly in small textile ateliers, first, it's believed to be not suitable for women for cultural, economic, and security reasons. I mean, this kind of job is a very physically demanding job, very low income with potential security concerns. So women are dependent on men for economic survival. We should also, of course, mention care responsibilities, which are at the core of this underage and arranged marriage practices. And also, of course, in terms of access to services, lack of formal work and access to education feeds into these practices, especially for younger women.
Hala?
Yes, so in Jordan, transactional sex did not appear in overt or openly named forms. Because of the stigma and the social norms, people were often more willing to speak about marriage as well, particularly early marriages and temporary marriages, rather than transactional sex explicitly. Even when discussing more direct forms of exchange, many participants spoke in the third person. So, because of the sensitivity of the topic, they would describe situations that happened to someone they know or that they heard of, rather than speak about themselves directly. This reflects on, how sensitive and morally charged the topic is. So our methodology relied on indirect questioning for this reason. Now, temporary marriages emerged as particularly significant in the Jordan context. These marriages sometimes functioned as coping strategies in conditions of financial hardship and insecurity. Families facing economic pressure or concerns about safety during displacement might arrange a marriage as a way to provide protection or financial stability. But while temporary marriages can be, socially sanctioned, they also reflect structural vulnerability. In some cases, they involve financial exchange and are understood to be short term arrangements. So, when choices are constrained by poverty, legal work restrictions, or fear of harassment, the line between protection, survival, and exploitation becomes blurred. So, beyond marriage, participants also described shorter term sexual encounters or relationships where housing, money, or protection were part of the exchange. What became clear is that these practices exist on a spectrum. So, from situations involving limited agency within constrained options to situations involving coercion and exploitation. Transactional sex in Jordan is not one single practice. It appears in multiple forms, shaped by economic pressure, legal precarity, gender norms, and insecurity across the displacement journey. While temporary and convenience marriages were more openly discussed in the early marriages, there were also more discrete or mediated forms. For example, one participant described being added to a group chat where sexual audio content was being produced. She refused and framed her decision in moral terms, but acknowledged that other women participated, often due to financial hardship. This shows how transactional exchanges can take indirect or digital forms, even, and how stigma shapes the way people narrate their proximity to them.
Thank you both, Merit and Hala, for this very fruitful discussion until now. And I think you both mentioned protection or financial drivers or like housing precarity or like crossing borders as drivers for coping mechanisms and survival strategies. And I want also to clarify something that you Merit mentioned that our project didn't focus on minors. So of course, we encounter underage marriages through our interviews with adults, and of course, I want to highlight that child marriages, underage marriages, are also a form of children's violence, and we don't consider it as a form of transactional sex in our research. Now, I want to move to the part of the sexual and reproductive health and mental health. You mentioned a stigma before. Building on that, one of the core findings of the research, and I think you mentioned, is how transactional sex practices intersect with sexual and reproductive health as well as mental health, often compounded by stigma and barriers to care. So, according to the research that we did in Jordan and Turkey, what are some of the key health impacts you have observed? And what kinds of barriers do people face when trying to access services?
Well, yeah, actually, sexual reproductive health is one of the most important aspects in terms of access to services in general, but access to health services. Regarding sexual reproductive health, prevention and protection practices are very lacking due to the lack of institutional access and economic reasons. And for example, the amount of monetary aid given to registered refugees is equal to 1 month of contraception pills or a box of condoms. Then, of course, when it's not provided publicly, it's not a priority. And there are actually migrant health centers, but they can be only accessed by registered people, which is some Syrian migrants and refugees. So, for most people, their only interaction with the health system was sexual reproductive health services during pregnancy. As I said, is very costly. People actually have to take loans from their relatives and friends just to cover it since they have to go to a private hospital. So there were a lot of also mentions of mistreatment in the hospital due, uh, due to practical issues like language barrier, but also due to xenophobia and racism, particularly towards Black women. Interestingly, for queer people, to some extent, they had more access to sexual reproductive health services, particularly protection and HIV prevention, thanks to local institutional actors supported by UNFPA. Of course, for only those who can actually access to these organs. And there were actually some critics of that, which I find very, very interesting, that some participants who are beneficiaries of this organization complained about the lack of holistic services, saying that they're only relevant for protection when it comes to their sexuality, but all the other dimensions of their life, like legal and economic precarity, is invisible in the eyes of the system.
Thank you, Merit. Hala, what about Jordan?
The health repercussions we observed were both physical and psychological, and they are deeply interconnected. On the sexual and reproductive health side, engagement in temporary marriages or other forms of transactional exchange can increase exposure to unwanted pregnancies, sexually transmitted infections, and unmet contraceptive needs. Although services may technically exist, stigma often limits access. In Jordan, participants described shyness, fear of judgment, and reluctance, especially among men, to discuss sexual health openly. Mental health was equally significant. Many refugees had already experienced trauma during conflict and displacement, including fear, violence, and instability. That trauma does not disappear once they reach Jordan. Financial stress, legal uncertainty, and social isolation compound it. Some participants explicitly linked psychological distress to sexual health concerns, including erectile dysfunction and relationship strain. Another major barrier is legal and social fear. People may hesitate to seek services because they fear being judged or exposed or misunderstood, particularly if their situation involves transaction sex or even temporary marriage. So the health impact is not only about physical risk, it's about stress, stigma, silence, and limited safe spaces to seek support, where structural precarity intersects with social conservatism and access to care becomes even more complicated.
Thank you very much. You both mentioned intersectionality. I think Merit mentioned intersectionality, and you tried until now to show how different group of people might have different experiences, and I think that was a very important methodological aspect of our research. Your data showed that the practices are not experienced uniformly. Based on the findings in Jordan and Turkey, how do these patterns vary across men, women, LGBTQI plus individuals? Are there specific forms of risk or precarity that stand out?
Yes, definitely. Intersectionality in this case is a very important lens to look at these patterns actually. When we look at survival strategies and transactional sex practices, I would say what we see is more an intersectional pattern rather than a solely gendered pattern. So these practices are shaped by what is considered tolerable within particular communities. In some communities, arranged marriages or forced marriages are more tolerable forms of coping mechanisms. In some, it's sugar daddies, temporary relationships, or in some, it's sex work. So I think it's mostly the gender per se, but the gender regimes of given communities that determines what kind of forms and patterns occur. And by saying that, my intention is not to argue for cultural essentialism or Orientalism, but to argue that these gendered regimes determine the patterns of survival strategies in forced displacement. I think very important is also particularly about queer people is that the limitations of livelihood and security are so much more severe, which generally results in involvement in more traditional, let's say, forms of sex work. Clearly, there are different approaches to sex work, and the limits of consent and agency are very much debated. But from our research, I think what was quite striking is that even actors working actively on sex workers' rights says that the conditions under which migrant sex work takes place is so precarious, so much more precarious, more exploitative, more dangerous, and more coercive that we cannot really talk about agency under these very hard conditions. So it's like more survival oriented.
And Hala, about Jordan?
Yes. So gender clearly shaped how transactional sex appeared and how it was discussed. Women were more often associated with early or temporary marriages, and their vulnerability was frequently framed in terms of protection, family honor, economic pressure. At the same time, women's agency was often constrained by financial hardship and social expectations. Men, on the other hand, were generally less willing to discuss transactional sex directly. There was a strong link between masculinity, being the provider, and shame around economic failure. Some discussions connected psychological distress and trauma, as I said in the earlier question, to sexual health concerns, including, as we said, the erectile dysfunction. This suggests that men also experience vulnerability, but it's expressed differently and often silenced. Regarding people of diverse sexual orientation and gender identity, we faced significant limitations in Jordan. Many LGBTQI groups operate very discreetly for safety reasons, and some decline participation due to protection concerns. When they're refugees, it's more of a risk. It's already a big risk, and with that, it's a compounded risk. That invisibility in itself is meaningful. It reflects layered vulnerability, being both, as I said, displaced and marginalized due to gender identity or sexuality. Now, in the broader multi-country studies, as we said, the queer people reported higher first-hand engagement in transactional sex. While we must be cautious in extrapolating specifically to Jordan, it's clear that intersecting forms of discrimination increase risk and reduce safe access to services. So, gender and sexuality shape both exposure to vulnerability and the ability to speak about it.
Excellent. I think a last question, maybe to close, based on your findings, if you had to highlight one key message, one key recommendation for policymakers and service providers, what would it be?
If I had one recommendation for the Turkish context, it would be changing the asylum system. Instead of forcing people to live in irregularity without legal and social protection and entitlements, access to formal labor markets and protection mechanisms, it must be reformed. But I think it's unfortunately, quite unrealistic recommendation, I'm afraid. So more realistic one would be protection mainstreaming all activities involving refugees and migrants, because I think a lot of survival strategies and transactional sex practices falls from the cracks when trying to deliver other services. So as long as refugees are kept in legal and economic precarity, survival strategies like sex will continue to emerge. So protection needs to be built in all services and not treated as a separate matter.
Thank you, Meritz. And Hala, you about Jordan?
Yes, I actually agree. So, the most important lesson from the Jordan findings is that transactional sex can't be addressed in isolation. It's deeply connected to structural precarity. So, policy responses must operate on multiple levels. First, access to safe and legal livelihood opportunities is essential. When refugees cannot work formally, when income is unstable and basic needs are high and they accumulate, vulnerability increases. Expanding access to legal employment and reducing prolonged legal uncertainty would significantly reduce pressure. Second, sexual and reproductive health and mental health services must be accessible without stigma. It can be worked also around. So services may exist, but people need to feel safe using them, particularly when issues intersect with temporary marriage, exploitation, or gender-based violence. So confidentiality, culturally sensitive outreach is very, very important, and safe referral pathways are critical. Third, we need to reduce moral framing and focus instead on structural drivers. When public discourse centers on morality, it pushes the issue underground. When policy focuses on economic security, protection, and access to care, it reduces harm. Ultimately, addressing transactional sex requires addressing the broader conditions of displacement, legal liminality, financial hardship, housing precarity, and discrimination. Without structural reform, individual level interventions will have a limited impact.
Thank you very much. I think indeed it is very difficult to suggest one and only one actually policy recommendation, only one key message, because it's a very complex phenomenon. And I like how you tried to unpack this complex research that we did in a very comprehensive way for our audience. And I think you really managed to highlight all the key issues that they are also presented in our multi-country report that you can find on our website. It was a very insightful discussion, and thank you very much for sharing your work with us. It was really our pleasure to have you with us today. In our next and final episode, we will turn to Switzerland as a case study, reflecting on how these dynamics unfold in a different context.
This series is developed by the Liminality Research Consortium with support from Refocus Media Labs.